Well, hello and welcome to this edition of Your Health, Your Wealth. I am your host, Dr. Eddie Patton, and another great episode that I planned for you today. I've been fortunate enough to be at a number of Dr. Reiser's talks and really was impressed with his work and leadership with this whole notion of the brain economy and brain health, and how important that is, particularly in this climate where we're so caught up in technology in healthcare. So I'm excited to have Dr. Reiser here with me today and taking time out of your busy schedule. You know, he's actually traveling, so he's recording this episode in Europe. So thank you so much for joining today.
Dr. Patton, well, thank you. And you know what, both of us, we're trying to stay away from the kidney today as much as possible. We're not going to go into the countercurrent mechanism and leave it for next time.
That's right. So, first of all, what brought you, all the way from Germany to Galveston, Houston area in Texas, UTMB? Tell us more about your journey.
Well, wonderful. In Germany, when you study medicine, you typically graduate as a physician unless you do a scientific thesis. And my scientific thesis was in the area of molecular kidney disease and biology. And I was so excited about that type of work that I extended it to a full PhD, 5 years. And we published interesting work around the kidney. And then really after graduating as an MD PhD, I had an opportunity to come to the United States with a stipend to do more research, at that time in New York at Albert Einstein College of Medicine. And I fell in love with New York, with the US system, and then did my US MLEs. And from there, my scientific scientist career has really been launched at Einstein, then at Harvard, then at University of Miami, then at Rush University Medical Center, and then 3 years ago, president and CEO at University of Texas Medical Branch, where really all of it began to come together for me over the years, yes.
Wow, that's an amazing journey. Well, we're happy to have you here in Texas and leading such a great institution and system there at UTMB and growing leaps and bounds. I mean, every time I'm driving down the freeway or around, I'm seeing a new campus or something else popping up. So congratulations on the success there.
Thank you.
Yes. Now, I want to just give a couple of stats before we get into this whole topic of the brain economy and brain health. But, in the United States, brain health conditions contribute to about 33% of the global disease burden. And we're talking about things like, mental health days or just taking care of our brain. And I do, as neurology and particularly cognitive, talk a lot about those different things, exercise, diet, that can protect the brain. Of that, there's 12 billion working days lost due to mental health challenges. And about 1 trillion, that's with a T, that's the cost per year in lost productivity. Brain capital combines brain health and brain skills, recognizing kind of our collective value and contribution to a strategic environment. So through a unified brain model of health, employees can activate what's called this brain capital through the workplace. So one statement that I remember from one of the talks that I attended that you were in is that investing in brain health interventions to strengthen brain capital in the U.S. could drive an additional 1.9 trillion in the GDP. So you lead, as I just mentioned, such a vibrant healthcare system, a growing system. When you think about this term brain capital, what does it mean to you as a leader, particularly when you're dealing with both physicians, administrators, and then what does it mean to the broader economy?
Wonderful. Well, you framed a lot of the issues very correctly, Eddie. And I'm glad you did, because what we are beginning to recognize more and more is that brain health and mental health are really inseparable, number one. And especially right now with the arrival of AI, it is more timely than ever to invest in the human brain because AI does not only mean artificial intelligence, it also means actual intelligence. And it does mean this more than ever. So the numbers you mentioned are staggering. They're so high that there's a huge economic impact right now from not addressing those numbers. But also, in the dawn of AI, there is a need more than ever to address those numbers. And that means that the brain economy right now is considered negative because we're losing out. So the brain economy is essentially something we all want to change into positivity. And you do that by allowing people to have better brain health, better mental health, and to treat diseases that affect brain and mental health more effectively with new approaches. And that is not only turning the economy in a more positive one with creating more output financially and economically, but it also sets us in the best possible position for being ready for AI so we can really harness AI instead of being afraid of AI because otherwise there's risk that it might replace a good portion of us in the workforce. And we don't want that. So it has a dual effect, the brain economy, and it's right now becoming a very, very high-stake topic. And I think more and more businesses, public education institutions, policymakers, and the general population, we are coming aboard together to do this.
Yeah, and you touched on a couple of important points. You know, we're moving so fast in this whole technology realm and with AI, but it's refreshing to hear that by investing in our people as well as our technology, we can be more productive and actually increase productivity, you know, at our institutions.
Exactly, because investing in brain health, which includes brain skills, cognitive resilience, mental resilience, we are allowing people to acquire a higher level of skill set that is typically also allowing them to be compensated at a higher level because the tasks becoming less tasks and more strategy outlook. And that is where humans are very strong in. And so I look at this as giving everybody more chances by getting more healthy, brain and mental wise, but also with that becoming essentially a promotion of their own position. And that's exciting.
And now tell us more about what you're doing there at UTMB to improve that productivity and address this whole issue of brain health and brain capital at your organization.
So when I think about an ecosystem, then a university and a health system is really an ideal ecosystem to run this very important, let's call it an experiment. It's really more than an experiment. It's an experience and an uptraining program for humans. But we have obviously the students, which is the next generation workforce, and it's our educational arena. We have the healthcare delivery in the healthcare system, our patients and our providers. We have research, and we have a domain that we call innovation, where we start new businesses and partner with the public and private sector on developing new products. And so when we came out recently and said we are going to abide by the principles of changing the brain economy into a positive one, that means that all domains that I just mentioned, students, healthcare delivery, research and innovation, are affected by programs that are aimed to increase brain health for people and increase the skill set for brain skills, and also allow people to uptrain and become fully AI ready so that they can use AI for the benefit of themselves. And so I'll give you an example. If we are investing in a new research program, we are still wanting to address many issues and study many diseases, but we are focusing with preferential identity now on brain health and mental health. So we would likely prefer to choose a brain project over one that's perhaps skeletal muscular. Not saying that that's not important, but it's about prioritizing. And when you start doing that, people are starting within the own organization to take you more serious when it comes to developing a plan and implementing a plan around a positive change in brain economy.
Hmm. And that is kind of a mindset shift, though, because again, leaders, particularly in healthcare, have up to now been thinking about innovation and how to be more streamlined, how to be more economical. But thinking from the mindset of investing in this human capital rather than just pushing technology. That takes a little bit of thinking outside the box. So have you found that it's been difficult to get people to think or change their mindset toward investing in their employees and invest in mental health? Because historically it's been more or less, hey, just suck it up, just work, push through. We've all heard these terms, but you're actually saying that, hey, I can increase the productivity of this employee by investing in their brain health. How do you handle that?
It's a constant reminder. There are obviously lots of conversations going on, town halls, expert panel, but it's also delivering early successes. I'll give you an example. We have implemented a connectivity app that connects our workforce on all campuses. And this way people can give each other compliments, they can see other people and highlight them. And I thought we might go up to a few thousand subscriptions. They're free within UTMB. And within a few weeks, we were at nearly 20,000 subscriptions. So there is this huge need, and it's used very much every day. There's this huge need for people to be connected to each other in the workplace. And people really embrace this new tool. And so by doing projects, and doing meaning not just talking about it, but also implementing it, you begin to get more and more trust with the workforce that we are not just trying to push down technology into the organization, and you allow more and more computer to take over your own task that you're doing every day. We are helping people to come and lift up in their position so that they can work with technology, but strategy-wise, they move up the ladder in the organization, which give them more opportunity. We had a recent engagement survey, and I was very curious, and we had very positive results. And so it shows that what we are doing is working. People are excited about the human capital. They hear the word human, actual intelligence, perhaps a little bit more than artificial intelligence at UTMB. But on the other side, Eddie, make no mistake, we are amongst the leading institutions that have implemented AI throughout the entire organization. So by allowing humans to flourish and their brain and mental health to flourish, we are seeing a much easier allowance on the flip side for AI to come into the daily routines of our workforce and our students.
You guys are trendsetters there at UTMB around this conversation, but so I'll ask you to stretch and think 10 years from now, and what do you think this conversation is going to be like around brain capital and brain health, 10 years from now?
Well, I really hope that more and more companies, more and more institutions, more and more communities are coming aboard similar approaches. So right now, there are, let me just frame it a little bit. There's a national, international dialogue going on that's in part led by a group at the World Economic Forum, which UTMB is also part of. I'm part of. Then there's a Houston-wide project that transforms the city with projects that are aimed at raising the brain economy. That project is called Project METIS. It's led by the Center of Houston's Future. And then there's the UTMB transformation that's led obviously within UTMB. And we fully endorse the Brain Health Initiative and live by those principles. I just mentioned a few. And others are watching us. So right now, as you know, I'm in Europe because I was in Brussels speaking at the European Brain Summit and gave a summary of the efforts in Texas. And let me tell you, the world was totally excited. And
Wow.
people are positive on the approach to invest in people's brain and mental health more than ever to really change these numbers. And you mentioned 10 years. I'm hoping in 10 years the brain economy looks much more positive. We have
Absolutely.
less sick days. We have happier, more resilient people, mentally more resilient. And we're embracing AI for what it's worth it, i.e. to do the tasks that we don't want to do, but we keep humans on the long-term strategy, on the ethical conduct, on the real thinking that makes humans so special and that no AI can really do. That's what I'm hoping to see. I'm also hoping to see that we have less mental disease and less dementia coming our way. As you know, in Texas, we have the Dementia Prevention Research Institute of Texas now, which is a $3 billion state program. I'm hoping with all those elements that the state of Texas is really the leading state and gives a great role model for other states and other parts of the world. And we're starting to see and have real progress in that.
Yeah, and from certainly as a leader, you're thinking about the bottom line as well, and and that's why I really like that statement, looking at the investment and the dollar amount, because a lot of times we may not think about that, like what does it mean when we're so focused on just technology, but people are worried. They're worried about their jobs and they're worried about their future. So that worry may not cause you to be the most productive employee whatever you're doing in healthcare, whether you're a researcher, like you said, student or physician. So to me, being able to unlock that underlying capital economically from the human capital, man, that's an exciting thing.
Yeah, and the last thing we want right now is worried employees and worried students. We don't want that. But you know what? We can't just also say, don't worry, it all will be okay. That's not good enough. That's not fair either, because AI technology will continue to come. It's how we engage with it and how much are we ready for it. And there's so
Absolutely.
much we can do there. And so I think the brain health and mental health is the new gym of the next decade. While I like to go to the gym too, and I think people should go, it is really to make the upper house of the body as strong as possible. And I
Wow.
think when you look at data, Eddie, and you know that as a neurologist, in 2010, so since about 16 years, the
Hmm.
brain economy and the brain capacity of humans has actually gone down. So
Yeah,
there was a shift because even though more technology comes, we have a little bit stopped thinking more, and we are not engaging with technology in a positive in a way that is utmost positive to humans. And we
that's
need to
right.
change that again. You know how much brain fog we sometimes have at the end of the
Absolutely.
day, looking 10, 11 hours in a computer on a phone. We need to learn how to do this much better. And there are programs we are developing that allow humans to participate in that help them with that.
Yeah. It's almost daily I'm counseling on just that. The fact that, your brain is very conservative. If you don't use it, you lose it. But on the flip side, we have neuroplasticity. So the brain is constantly trying to rewire and connect these circuits. So, and you have that ability, but you have to exercise it just like we exercise our bodies. And
100%. And you know what I always say? Start tonight. When you drive home, don't put your route finder in, whatever the favorite app is that you're using. Try to remember how you get home and challenge your brain and focus. That's a good start.
Yeah. So in closing, I love the fact that you highlighted the things that you're doing at UTMB. I mean, certainly see you all as trendsetters along this. But what are some practical things that healthcare leaders can just do, even on a small level, just to start implementing this notion of brain health and brain economy and protecting yourself throughout their workforce? Are there a few just little small practical tools that leaders can take?
Yeah, no, I love this question. So one piece I would advise every leader right now is to take a look at your team. Don't necessarily replace your team members. I'm not saying that, but you might want to add a few others that you typically don't have in the room together. So I have now routinely AI director, neurology director, psychiatry director, or representatives thereof being part of the C-suite when we have conversations, because we wanna less edict what we are doing. We want to build from the bottom, from the workforce up. I think it's a different type of composition that is needed right now to make people comfortable and to really have the continuum of the entire system when we roll out bigger programs that affect the entire organizations. That's one piece. The other piece is routine conversations. We got to be honest.
Absolutely.
We got to be honest about what's coming our way, which is a lot of technology and AI, but we also got to be hopeful, appropriately hopeful, what we are doing to elevate human brain capital and human mental capital. And there are ways to do that. That's another thing. Then I think we need to take a serious look at the educational component. Neurodiversity is a big topic. Right now we're trying, and I'm speaking for the world, we're trying to bring everybody to the middle. People who have ADHD, so maybe let's treat ADHD and bring them to the middle, give them some medicine so they can study the same way others are studying. Maybe they need a different type of studying, and allowing them to do that can mean that they become way more productive and be very useful and much more useful even to your entire system and enterprise. So I think neurodiversity is another part that I'm excited about, because in the brain economy, we're not trying to bring everybody to the same level. We are recognizing people for who they are and see this as a strength and bring out the best in all of them by customizing the programs to them and not the other way around. And so having conversations about that, again, is something that needs to be started right now. I see a lot of executives on the meetings where I go still talking about piloting projects in revenue cycle or even in the hospital, typically very boxed in with 10, 15 people. That's not, I think, a good way of bringing this level of new technology to the human capital. The conversations have to be broader and more inclusive.
Absolutely. Wow, I tell you, you've got me more excited about this. I look forward to working with you and continuing to grow this thought, this notion, because it's so important, particularly as we move into this new era of not only healthcare but with AI and innovation. We should embrace it. It's something that we shouldn't be afraid of. But let's not forget about investing in ourselves and investing in our brains as well. So tell us, are there sites, or can they go to the UTMB site just to hear more about some of the innovative things you're doing there?
Please, I think more and more will come online. If you look at the UTMB town hall, there's a recording of the last town hall, which I believe was April 22nd. And I speak a lot about brain economy. I also want to mention we took on the responsibility of as UTMB in Galveston to run the Blue Zone project. So we're turning Galveston into a blue zone.
Absolutely.
It's a 4-year project. So we're hoping to transform together with the community that we serve by bringing, as you know, healthier food options, food choices, community service, cooking together, gardening, all those elements more to the forefront. And that's another very interesting project, and you can read online already about UTMB, Galveston Blue Zone, and that is also something that elevates, as you know, the brain capital. And there will be more and more information online, and I'm hoping, and I'm very hopeful that other organizations will follow along with us. And I think overall, I'm beginning to be more optimistic than ever that we as humans can not only utilize AI, we can also continue to dominate it with what is so uniquely human, which is our brain and our mental health and capability and capacity.
Well, this has been a great interview. I hope sometime in the future we can have you back on to get some updates and learn more about this. And I just want to thank you, Dr. Reiser, for taking time out of your very busy schedule to talk to me and our guests about this notion of brain health and brain capital, and look forward to the more exciting things coming from you and your institution there at UTMB.
Thank you so much, Eddie, and it's a pleasure to be on your podcast, and thank you for talking with me. Appreciate it.
If you enjoyed this episode of Your Health, Your Wealth, please share it. I'm going to include some of the links there that Dr. Reiser included for the programs they have there, and hope you got some away from it, some key takeaways. But get out there, exercise, relax, and take care of your brain, because your brain is part of your capital and your contribution to society. So tune in next time for future episodes of Your Health, Your Wealth, and be blessed.